Dental implants, information and consent form. After careful examination, I have been advised that my current condition might be improved by replacing my missing tooth or teeth with an implant or implants and one or more artificial teeth. The placement of dental implants is a treatment option that acts as a support for new restorations, fixed bridge work, or a removable denture. Restoring lost tooth structure will provide adequate chewing function and speech, create and maintain an aesthetic appearance, and prolong the retention of all sound teeth. There are alternatives to dental implants, including but not limited to no treatment, removable partial dentures for eating and aesthetic aid, crown and bridge work if possible. I understand local anesthetic will be given during the procedure and some discomfort following treatment may develop from the injection area and from opening my mouth during treatment. I understand that my gum tissue may be lifted and an implant or implants will be placed into my jawbone. I understand that sometimes when there is insufficient bone, a bone graft will be required by either using my own bone harvested from my own jaw and or certified natural bone mineral, usually of synthetic origin. I understand that sometimes the bone grafts will be covered with my own tissue. However, when this is not possible, resorbable collagen membranes, or less commonly, a non-resorbable membrane might be used. I further understand that if during the surgery, if the clinical conditions turn out to be unfavorable for placement of the implant, my dentist will determine how to manage the situation. It may involve a bone graft plus a soft tissue graft, which may delay the healing process. I understand that some of the problems that may occur are temporary. Pain around the implant, infection, tingling and loss of sensation. In rare occasions, altered or loss of sensation in the mandible, the lower jaw, lower lip and lower chin may be permanent where implants have been placed in the back of the lower jaw. I understand that every measure has been taken to reduce the risk of complications, such as detailed analysis of the bone, nerves and sinus anatomy, using CT scans, 3D computer reconstruction of my jaw and models. I understand that the success of dental implant surgery is high and that the implants or implants is likely to last my lifetime. However, as in any human implant procedure, heart, kidney, artificial knees and hips, no absolute guarantee can be given. I understand that the success of dental implants or implants also depends on strictly following the pre- and post-operative instructions, following oral hygiene instructions, attendance for yearly examinations, and refraining from smoking, regular 6-monthly scaling and polishing, or remaining teeth and or implants are paramount to look after teeth and implants to prevent periodontal gum disease and peri-implantitis. Understand that the prosthetic phase of my treatment is just as important as the surgical phase for long-term success of the reconstruction, which is what we desire. Patients who are under 25 years of age will have continued growth in the jaws over several years and may result in change in the alignment of the teeth, resulting in new crowns or bridges to correct the misalignment in the future. I understand that some complications can result from the implant surgery, drugs and anesthetics. These complications, if any, are usually temporary and may include infection, bleeding, swelling, pain, facial discoloration, numbness of the lip, tongue, teeth, chin or gum, jaw, joint injuries, muscle spasm, tooth looseness, tooth sensitivity to hot, cold, sweet or acidic foods, shrinkage of the adjacent gum tissue upon healing, resulting in elongation of some teeth and greater spaces between the teeth, cracking or bruising of the corners of the mouth, restricted ability to open the mouth, speech difficulties, allergic reactions, injury to teeth, bone fractures, nasal sinus penetrations, delayed healing, and accidental swallowing of foreign material. Published research indicates that permanent complications are rare. I understand that it is vital for me to continue to see my dentist. Implants, natural teeth, and appliances have to be maintained daily in a clean and hygienic manner. Yearly examinations are important in case of any adjustments that are required. This yearly examination may include visual examination, gum probing assessment, and adjustments of the bite. Normal fees will apply for these procedures. I understand that the complications may arise from my gum disease, and I may be referred to a specialist, example a periodontist, at my own cost. I acknowledge that I have provided an accurate medical history, will follow treatment recommendations, and have had the opportunity to ask questions about these risks. I understand that bisphosphonate medications can increase the risk of implant failure and bone necrosis by 5%. I understand that although smoking is not a contraindication for dental implant therapy, it does increase the risk of implant failure by up to 3 times. If clinical conditions prevent the placement of dental implants, I defer to my dentist's judgment on the surgical management of the situation. I also give permission to receive supplemental bone grafts or other types of grafts. I understand that the fee for my implant stage 1 does not include the fee of the restorative work. In my particular case, I also include the following clauses. I hereby provide my voluntary information consent to Dr. Nunes and his dental team to take photographs of my dental case for planning and teaching purposes. I understand that these photographs may be used for educational training or illustrative purposes within the dental field. These photographs taken may include intraoral, extraoral, or radiographic images of my dental condition. These images are intended to aid in treatment planning, case documentation, dental education and training, scientific and/or clinical presentations. I understand that all efforts will be made to protect my privacy and confidentiality. These photographs will not include any personal identifiable information. I acknowledge that the photographs may be used for educational and teaching purposes by Dr. Nunes and his affiliated institutions. I retain no rights or ownership over these images. I consent to the use of these photographs for an indefinite period of time. I understand that I may revoke my consent for the use of these photographs at any time, provided that this revocation is made in writing to the dentist. I have had the opportunity to ask questions and my questions have been fully answered to my satisfaction. I certify that I have read and fully understand that this document, and I hereby give my consent to perform the necessary treatment.